Good afternoon. This is United Medical ACO, UMAC TV. My name is Kemal Erkan. Today is August 5th, 2022. I'm here with Sean. Sean, how are you doing?
I'm doing well. How about yourself?
Good, very good. So today we have our COVID and monkeypox updates, and as well as we have a speaker from our revenue cycle management side. Christina is going to join us, and then we are going to discuss patient inquiry online process for United Medical patients, and also engaging patients in terms of the billing side of it. So, and then we are going to have the global events and the U.S. economy updates as it's affecting all of us. So we'll start with our COVID updates.
Sure. Yep. So we can jump into our COVID updates here. Happy August, everyone. Summer's flying by, but we do have our COVID updates here. So I'll let us know that the U.S. Is increasing in total cases a little bit. We did have that plateau we saw as we were in the beginning of summer, but as we're moving through, we know people are out and about, moving around, traveling with their summer plans, summer vacations. So we do see that increase going up with the COVID cases. Now, with that, we know there were some mandates being brought back with mask regulations. We know that certain areas, for example, airports have always had these going on for this travel, but now we're seeing potentially there's discussion might be back in classrooms for when school starts again in the fall. So we're going to keep our eyes on that with the COVID restrictions and guidelines regarding each state and across the nation as a whole. Vaccination wise, they are up. We have the US total updates. The CDC actually didn't update this. This is still the number from July 28th, posted on their website. So that number, we will just remind everyone, as of the 28th, it was at 632,500 children under the age of 5 getting their doses since the middle of June. So that was a number we were paying attention to, as we know that those vaccines only came out, made available to those younger population fairly recently. But total wise, we have over 223 million being fully vaccinated across the nation. And then Delaware's numbers are seen on the colored graph down there. It's being broken up by the age gap there. So we have those comparisons to see, and it looks like it's roughly 0.1% as we saw going week by week across those age categories respectively. And then moving on to our monkeypox, we did see some new updates regarding that across the nation and also some states. So initially we saw New York and Illinois declaring the state of emergency over monkeypox. And then just recently, I think it was yesterday, the Biden administration announced it as a state of emergency across everywhere. So
it was yesterday or the day before.
Yeah. So as we had mentioned, when we first started covering it, I think it was when we had the first case in the US, we said it's something to pay attention to. I know Delaware, as of yesterday, still only had 5 cases. But I know the number, if we're looking at that last slide there across the entire continental US right there, had 6,600 across the nation. So Delaware's at 5, but 6,600. So we do know that they were working on making, I think it was 800,000 vaccines available. These vaccines are similar to that of the smallpox one. You know, there's obviously going to be more testing and variations that they may have to tweak these vaccines to make them more effective, but it is an ongoing process right there.
So the total cases, is it 25? Is it 6,600 is in US, so 25,000 is worldwide?
Yes.
Yeah. So now the symptoms of monkeypox is fever, headache, muscle aches, and backache, swollen limbs, knots, chills, exhaustion, respiratory symptoms. So these actually you can find them on the CDC website. Yes. Now the problem, again, as usual, like we did bring this up before. I think the issue that while we wait until this becomes like an the emergency level, could we have done something before? When we first emailed the state medical director, the first response wasn't like a strong response. So, and I think these are maybe not preventable, but maybe we can actually decrease the impact of it, or we can better prepare for these. And I don't think we learned much from COVID. And hopefully this won't become something similar to that.
Yeah, I'd agree. Like we said, that initial response we got, we know that it was just, we were mirroring, I think what the state of Massachusetts was doing at that time, because that's where some of the initial cases had first popped up. But as you're saying, it didn't seem like there was a sense of urgency or stress response on this to definitely catch it before it spreads, and exponentially.
So far, there's no direct treatments for this.
Correct.
So we're kind of on our own. So you can actually avoid the body contacts and some of them are similar to the COVID.
Yeah, I was going to say a lot of the symptoms and precautions that people can take are actually in line with COVID itself.
Yep. So in Delaware, we have 5 cases confirmed.
Yes,
I bet there's more than 5. That's what we know.
That's what we had confirmed as of August 3rd. But like you're saying, people aren't reaching out, getting tested. There's no way to actually know. They
may actually not know that they're having those symptoms. Well, they may have those symptoms, but they may not know that they're having the monkeypox. So, all right. Well, thank you for the COVID update. So we'll be back. So I'm going to let Christina in. And we'll put you in there.
All right.
Hello, can you hear me okay?
Hey, Christina, how are you doing?
I'm doing good. How are you?
Good. So we can hear you just fine. And so we are going to discuss the patient inquiry online and engaging patients in the RCM world. So you're gonna run those for us, and then hopefully maybe some of our patients are watching this, so then they can actually understand how to utilize some of the tools that we have. So if you can briefly introduce yourself before we start.
Yeah, sure. So my name is Christina Abrams. I'm one of the client managers here at United Medical. Been with the company now for, I think, almost 7 years at this point. So I'm very excited to be discussing this topic today. We get to work with a lot of patients on a daily basis, so it'll be nice to go through these slides and provide additional information.
Thank you. Christina, what I'll do is I'll start the video again so that I know you are actually going through your PowerPoint order. So go ahead.
Okay, so just to start out here, again, I'm going over patient inquiries and engaging the patient. So just to start out here, we've got a couple different options available at the back of our slides, or on the back of our statements, that are there for if there's any questions the patient might have in regards to the statement that they had received from one of our practices. So there's a couple different items that we could address that might need to be updated. So the patient might have a balance dispute. Maybe they want to set up a payment plan. Maybe a payment that they had made to one of the practices maybe isn't reflecting in their balance. There could be an insurance info update that needs to be done. Maybe the patient had gotten a new insurance. They could also, if they wanted to sign up for one of our nutrition classes that we have with the United Medical ACO, they could do that. Or if they have any medical record requests that they need forwarded to one of their other providers, it's also an option that's available on our billing.umusa.net website. So in the next slide after that, it's just some of the reasons, again, for the patient inquiry. We discussed a few of them just a moment ago here. We also have, there could be maybe collection balance inquiries that are there. If they want to pay a bill, if they want to set up a payment plan. Maybe if there's a request from a payer or an attorney, we might receive a patient inquiry or a new statement request. Again, these are some of the items that we would have that we would receive through our patient inquiries. On the next slide here, where would we go? So again, we would go to billing@umusa.net. The patient would be able to put in an inquiry on our website there, and they could select one of those options from the drop-down list that would be available for the reason for the inquiry. And then we would be able to then reach back out to the patient with the resolution to that inquiry. So We do have the option, so patients could either receive a phone call back from us if they had wanted to put the inquiry in for a phone call, or we can do email resolutions, which I like because that it saves them some time. They don't have to wait by the phone waiting to hear back responses from their inquiry. They could just have the email that would come back to them, letting them know that everything is taken care of.
So now, I think with the COVID, as I always say, there's always some silver lining with some of the crises that we go through.
Mhm.
And maybe one of the silver lining is that we were able to actually utilize our online application and online tools much better than before. And I think everyone is more open to utilize them. Before it was everyone was trying to get a phone call or trying to get us while we weren't available, or when we called the patient, they weren't available. So now we were able to actually master the online tools, utilization of the online tools. So I think that's one of the really good outcome of this maybe crisis that we went through.
Yeah, absolutely. As we know, our patients' time is valuable, so we want to make sure that we're providing, an excellent level of care, regardless of the time that it is, so that they don't have to wait on us. We could be able to take care of that for them and get that information back to them. So the slides are now what we're seeing is just kind of an example of what that inquiry would look like. So that I had a question in regards to my bill, you'd receive a message back letting them know that an inquiry was created. And then once we have the resolution for that inquiry, it would then send another email out, just letting the patient know that we have everything taken care of. So we would let them know, okay, according to that inquiry, it had been resolved. Initially, we had like an example inquiry there for about a bill that they had thought that the bill was covered by the insurance company. Our response back in this instance was that the balance was applied to that patient's yearly deductible. So they would have that information back. And then if there was anything further, we could always, they could always reach back out to us if need be. But that way, at least they didn't have to wait for a call back to be able to get that answer. They could then go about what they needed to do on their day-to-day. So what I had next on that is on our website, we would have there's a couple different places that they click to be able to get to those inquiries, or if they had wanted to make a phone call to us to discuss a bill or so as well.
So just kind of show quickly on our side, I'm going to share my screen. So we can kind of see how easily we are able to reach out to these pages. So
we do have the patients tab for patients, as well as along the bottom there, we have an option that is for patients. Mm-hmm.
All right, here's that click, and then that's the first thing, right?
Yep, it's the first one that's there. So they could select a patient inquiry. And it would take you right to that inquiry page, so they'd be able to select if they would like to receive an email confirmation, which is what we were discussing there, that we could send them that email back with the response. And then we would be able to select the reason for the inquiry.
So if they were to just do the insurance info update, they really don't need to call
Yep.
on us.
Sorry.
Go ahead.
So the insurance information update is great, because then they can just include their insurance information right on the inquiry itself. So they can include that insurance company, their member ID, group number information right into the inquiry, so that they don't have to worry about providing that to us over the phone. We'd be able to just get that updated in the system for them and resubmit their claims.
So then, since I clicked the yes, I would like to receive an email confirmation, and I put my email, and this would get me a confirmation with my ID number, right? My reference number.
Yes.
So let's see if I received that. I just received it.
So
And yep, this is, I'm going to bring it up to the screen. So United Medical confirmation. So then they have the confirmation ID. So then as we are doing our updates, then they would actually get an email back with the updates, right? So this would be taken care of, or it's already taken care of, or if we have any additional information, we would be able to reach out to them.
Yep.
All right, so we can
Absolutely.
go back to your slides.
Okay, so those are the options that we had available. Again, Kemal just pulled up the website, so we do have those couple icons that are available on there to add the patient inquiry in. If a patient is also calling because they had wanted to make a payment, there is an option for them to be able to pay online as well. So you'd be able to click the button to pay online, and it would give you the directory of the different providers in our network, broken up by like the specialty. So if I had wanted to do, let's say I wanted to pay a bill for United Medical Clinic of Delaware, I'd be able to select on primary care, and then I'd be able to pull up their clinic and then pay the bill directly.
Yep.
So moving on to our next topic on it. So we do have the inquiries that are there. Sometimes we may need additional information from the patient in order to satisfy one of their medical claims. So patient engagement is really important. You know, a patient does play an important role in their healthcare that's there. And there are a couple of things that we might need to reach out to them about because they could only be updated by a patient. So some of the things that we have is the patient selecting a primary care provider, updating or backdating the coordination of benefits for a patient, or eligibility information. So selecting a primary care provider. So we actually did, you actually did a presentation a while back on how to select a primary care physician, and it's on our United Medical YouTube channel. So we do have that available for patients if they need any assistance on how to select a PCP. But there are some plans that a patient may have that might require them to select a PCP at the beginning of the year. This information would be, is usually added to their insurance card. If a patient doesn't select a primary care provider, their claims could be processed as like out of network, or maybe requesting a referral. Only the patient can actually update their primary care provider. So we wouldn't be able to do it for them, but they would just let their insurance company know, okay, I would like United Medical Clinic of Delaware to be listed as my PCP. So they would have that added in, and then those claims would then be good to process. So we'd have that. And then we'd also have coordination of benefits. So who's paying first, who's paying second on that? If a patient has more than one insurance that's listed, the payment order needs to be established with the insurance companies. So again, the doctor's office or our office is unable to update coordination of benefits for a patient. They would just need to let each of their insurances know who'd be paying primary and who'd be paying secondary. Oftentimes, or there's some insurances that are there that will have you update coordination of benefits yearly. Like for instance, we've got Blue Cross Blue Shield in New Jersey, where they'll send out yearly letters having patients update COB. If they don't hear back from the patient, then they'll start denying their medical claims until they hear back from the patient to have that updated.
So that they will receive a statement from us, self-pay statement, so then it would become like a patient responsibility, right?
Yes, it would be patient responsibility if the COB has not been updated. Because again, we don't have the ability to do that for the patient. They won't accept our assignment of the coordination of benefits. It does have to come from the patient for them to be able to get that updated. And not just updated, but also backdated if there's a older date of service that's there and they have not, or they're not verifying that they are the primary insurance, they think another insurance is primary. The patient might also have to call the insurance to let them know, as of January, Medicare is my primary insurance, or Aetna is my primary insurance, and let them know. That way it would be taken care of from that starting point through to today's date. And then the last one we have is in regards to eligibility. So whenever a patient goes to the doctor, they may be asked for their latest insurance information, or if any insurance information has changed. It's extremely important that we have the correct insurance information, so that way we know that claims are being sent to the right insurance, and so they're processing properly. it's a patient's responsibility to provide their doctor's office with the most accurate insurance information that's there. We understand that, people move and addresses change or names change and things like that, but that stuff does need to get updated with the doctor's offices so they can send that out so that the insurances can recognize the patient. So let's say your last name has changed. They would, or if my last name had changed, they might not recognize my claim when it's being sent over to the insurance company if it wasn't updated with the office to the new one. So again, if that information is not updated, and if we don't have incorrect insurance information that's there, you'd be hearing from maybe our office if we had to send you a letter to update information, or if there was patient responsibility for that claim. And that's pretty much what I had.
Well, so Christina, the patient communication is not only it's important for the billing side, but it's also important for the clinical side. And we are utilizing our QuickBase database to make sure that we maximize the most accurate communication with them. So we use them for our ACO patients when we are trying to reach out to them for their follow-ups with either with PCPs or with their specialists, their blood work, how to sign up for diabetes sessions, and also the other events that we are doing. So we are communicating those with our patients. On the bariatric side, we are also utilizing them as well. So pretty much most of the follow-ups are through these emails that we have from the portal. So I think it's extremely important for our patients to provide us accurate email addresses so that they, what we know is like when we call them or when they call us, it's chances are kind of low for them to get us or for us to get them, because when we call some patients from our case conferences, like they're either at work or some of them are teachers, so then they're actually teaching during like 8 to 5. So then the only way that you can efficiently communicate with these individuals is if you are utilizing the electronic portals, and hopefully we can actually get more patients sign up for our patient portals, and understanding that this would be more efficient for them.
Yeah, it definitely helps out because, we want to make sure that all of our patients have the opportunities that we have. We have a lot of benefits with the ACO. There's a lot of opportunities that patients have with like the bariatric webinars that we have, or with when we're doing these, so that they have that all available to them, and they might be missing out if they are not signed up for their email, if they're not signed up to the portal for them to be able to take advantage of what we have to offer there. So.
Yeah, absolutely. Well, thank you so much for joining us today.
Yeah.
So I'm sure we'll have you again in the next couple of months.
Okay. I hope you have a good rest of your day. Thank you.
All right. Sean, you're in my room right now, but I still have you in the waiting room, so I'm going to let you in now.
All right.
I'm
back.
You are back. So as you are back, we have a lot going on globally, and also the impact on U.S. economy. This is again why it's important for us, is because we are actually seeing the results of these. Someone's action is impacting what we do as a patient, as an individual who live in this country, and understanding why these things are happening is important. So when first I heard about Pelosi going to Taiwan, the initial reaction from Pentagon was they were not in favor of her going, but it was already too late.
Yeah.
So, and then it becomes like the ego game. So like, if you don't go, that's one problem. If you go, that's another problem, right?
Yeah.
So, but I think she did a really horrible mistake. And then the way that she put us in a situation that now we have, not like we don't have enough problems. Now we're adding another big problem. Now, China, whether we like China or not, we have business with China. So the supply chain is coming from China. So unless you have an alternative, routing that relationship is just pure stupid. And I think she is being pure stupid. So I don't know why she put us in that situation. No one is able to get back from that. But I'm actually kind of like nervous that we are in this situation.
Yeah, and as you're saying, that ego thing where it's and someone in her corner may say, oh, well, China's not going to tell our advisors where they can and can't go, so we're going to do it regardless. But I'm sure that along the lines of planning this visit, there must have been advisors telling her the consequences, and before even announcing that you're going to go, I'm sure that there was multiple people telling her to not even consider it in the first place. But like you're saying, it could be an ego thing. And
I think there's a hidden agenda, in my opinion. And, like sometimes we kind of make, we talk about these things and then later on things are happening. Yeah. There is no need for this right now. So we already have done this in Ukraine, and then there's a huge problem going on. Mm-hmm. So if everyone was on board, even the president wasn't on board with this, because I remember one of his videos last week, he was saying that no, that's not happening. The visit is not happening. Now, what would be the benefit is something that we really need to kind of think about. So there is really no good benefit from this. Well, if we want to go into war with another big country in the world, so then fine, do that. But then if this is just irresponsible behavior of Pelosi, and if this is a way of her getting the attention from her husband's DUI accident, like hit and run accident, and then just trying to focus us into this, it's a big problem. I mean, she has all these issues. I mean, her 80-year-old husband hit someone with his Porsche and they didn't stop. He was drunk. And then we are not talking about this. We are talking about her irresponsible decision to go to Taiwan, which there's no need right now. Yeah. But we see this problem in different parts as well, right? So, like,
well, another thing with her husband with the insider trading, that they were saying how her giving signals, and if you look at her, stock investment history, where she's making millions of dollars off of buying, stock options or shares just days before announcements, where it'll clearly sway a stock one way or the other, 10% or so. And then she's in denial of that. And there's actually a clip I had seen recently where a reporter asked her, did your husband buy stock based on some of the tips that you may have provided him? And she, no, and put the microphone down and walked in, like, no further. But like, you could tell uncomfortable on the topic.
Dementia is something that she needs to look into. But I think she's playing very well for her age. This game is like for her to actually put us into trouble, and then she went through that because it was already too late for us to get out of it. Yeah, so everyone had to support it. One thing that we discussed last week, not on live, but you and I when we were getting ready. So I think there's some way somehow the media is being so well controlled. Like Prince Harry was actually lecturing us about democracy, the monarch who's lecturing US for democracy, and then there is Hunter Biden issue being kind of like swept underneath. So all these things are happening, and then no one is talking about it. But the bits and pieces of it is out there. So and then there's this huge Taiwan issue with all these disagreements. I think we really need to focus on the big issues, and that's still not happening.
Yeah, and I think, as we've said, this is kind of a theme across these, like you're saying, the media and what it's playing, its role that it's playing in some of these ongoing affairs, and what actually ends up developing because of what is released and what is deliberately kind of hidden. And sometimes, like you're saying, there could be distractions. Like we know the trial with Johnny Depp was all over the news, and not saying that it's irrelevant, but how much was our average citizen really impacted by what kind of deposition was settled that she had to end up paying him, versus there's other things with politicians. We knew the trial with Epstein's wife going on,
True.
and that was just a day. It was just mentioned. Yeah, she was sentenced, found guilty. That was it. There was no details. There was no media live stream.
It occupied everyone for a while, right?
Yeah.
So the same thing with this Brittany Griner.
Yes. So this is another.
I was looking into this. So she actually plays in Russia.
Yeah. So she was a
She wasn't
WNBA
she wasn't
and
like a tourist. She plays
international.
And apparently she's getting like some high dollar amount for like what she's not worth here is being paid to her in Russia.
Yeah.
And she has a domestic violence on her record. And now she's trying to smuggle drugs into a different country.
Yep.
And then what I don't understand is why do we care about this much? Like maybe like you have a different perspective of this. So I mean,
she's my favorite player. No, no, I agree what you're saying, and again, it could just be another distraction cover up where let's all focus on this name. Let's just have this keep resurfacing. Brittany Griner did this. This is what Russia's trying to do, but if you look at the detail, I mean, they're now proposing this prisoner swap where it's an arms dealer who's sentenced to 25 years. Like that's, in my opinion, way more serious than somebody having the CBD oil. And in another light, look at all the other people who are incarcerated in the U.S. for drug charges. Like no one's fighting for them to be released if they got caught.
What does it matter if she's going to be in prison in Russia or in the U.S.? Exactly. So what she did is also crime here.
Yeah. So
why would I didn't even know who she was until this came up.
Yeah.
So, but then it's just like I think there's a really smart way of media occupying us, like getting our attention. Just even like I had to go and understand who she was, and I had to do some research and finding out all the other trouble that she was in. So why do we have to make her like the national hero when she's just smuggling drugs to a different country? I just don't get it.
I put a slide in there too that the two basketball teams in the U.S. WNBA teams were having a moment of silence for her after being sentenced, which if we know what a moment of silence is normally reserved for someone passing, in a more tragic or...
Was she doing that? Like it's another basketball player from a different country was doing the same thing when they were coming to U.S. Would we have the same?
I doubt it.
So it's a crime. Crime is everywhere. It's like if it wasn't a crime here, but she did, and if it's a crime in some other country, that's still a problem. But you can argue. You can say, well, like she didn't know.
But drugs are pretty universal.
Yeah. She pays taxes in Russia, so
she would be familiar with.
Why is she like? But this is a really mastermind. Like let's get public's attention to somewhere else. Johnny Depp, as you said, that trial took how much time from everyone, and then in the meantime we were paying $5 for gas, and it's still $4. And then now all of a sudden, the president comes out and then say, "Well, we reduced the gas price by 25% or 20%, but still 64% higher
from initial." Yeah.
So anyhow, I guess we'll get to learn more about these things in time. So how about from the U.S. economy, what we have there?
Yeah. So another thing that was kind of going on, obviously, we know its recurring theme is inflation. Like you're saying, the gas prices, everything going up. So we do have some updates on that. But more specifically, one of the ones that I thought was kind of relevant, since we're just talking about Pelosi's visit to Taiwan and how that's going to impact relations with China. We have here America taking on China with the giant microchip bill. We know this is obviously going to play a major factor going forward with different technology uses. But
so this is kind of like we are depending on.
Yeah. So
that's exactly what I'm saying. So if you are really depending on this country,
you want to take a fight with them.
Really important, essential things. Why would you want to rock the boat with them?
Yeah. So that's what we're trying to challenge them. But as we know, China is the lead producer for a lot of technology devices and things that are cheaply created over there with just labor costs, where a lot of stuff is made in China. So like you're saying, why rock the boat? And
or they find the alternative before you rock the boat. Like I always tell people, if someone is not happy with their employment, they should find a job before they resign. So I always tell them, employees, like you don't want to just leave, because for the other party, like when someone else is hiring you, you have more value when you are employed already. But if you don't have a job, You are not.
Yeah, you seem desperate.
Right?
Saying, well, where
So
else? Are you
it's
gonna
same thing if you, there's like, I don't want to get into the details of it, but like I can make this example, I can multiply this example with so many others. But if you are already taken, you are more valuable. So if you don't have an alternative, then why would you actually, why would you make things more
You want to
difficult?
have
Because we end up paying for it. So that's like, again, that's why we care about these things.
Yep.
Now, like what happened in our surgery center in the last couple of weeks, some of the supplies are not being available and then they're on back order. What does that mean? That means we are going to actually slow down the procedures. We are going to do less. We are not going to be able to reach out to more people. So like when people don't understand, sometimes like, a couple of my friends, they're like, why are you guys talking about these things? I'm like, because it's affecting us. So like, if you don't understand that when there's a shortage of supplies which is coming from these countries, then we are actually we are going to have these these troubles. So find an alternative, and then you will be able to actually be in a better position. So I got a message from one of our directors, and she's saying that the biggest chip manufacturer is in Taiwan, actually. Well, that's not the way of finding the alternative, because Taiwan is China.
Yeah.
So it's not an alternative.
Yeah, China is claiming them as their.
And it's a little tiny country. It's 24 million, I believe.
Yep,
right there. So.
Well, and as you had in that video too, you saw that China. Well, before Pelosi even visited, they said there'd be severe consequences, and now you saw their response of this militarism propaganda of live firing drills, and
it's
I
not
don't think it's a coincidence
for sure. So that's kind of like where we are with that. So now, what happened to Biden's cancer?
Swept under the rug. We don't know.
Was it on COVID, and then no one is talking about it. This is why I'm kind of like worried about all these stuff. But we are not getting the information.
I feel like there's just we're just given samples. It'll just be mentioned and no further detail or conclusion or resolutions kind of ever provided. Or so
he said he did have cancer.
Yeah,
just like anyone else in stage of the next day he was COVID, and then a week later he was still COVID, and then I think they're isolating him somehow. But that's kind of interesting how no one is questioning. No one is asking this question. No one is asking questions about Hunter Biden. So there's a huge elephant in the room, and no one is talking about it.
I agree.
So is that not happening?
Well, it brings us back to our point of why no one's talking about it. Who's, with this media, what are they choosing to talk about? Why is it intentionally being, pushed to the corner and not in the spotlight? So like you're saying, more important agenda, more important goals. I
remember Ivana Trump's, she was on a public plane, because like I say public plane because they don't fly public. So she was on one of the commercial flights. Sure. So, and there was some confrontation. So then they were that actually kept media very busy, and everyone was talking about it. And there's Hunter Biden, huge elephant in the room. No one is talking about it. So amazing. But then yet we are still paying $4 per gallon, and then that actually is a good outcome because we reduce it to $4.
Yeah, which is it's better than $5.09. Sure, but was it better than?
It was $2.50 right? Before. So, but now just reducing it by 20%, he's trying to get credit for that.
Well, and another thing too, we didn't talk about this last week, but the White House trying to almost redefine what a recession is, because with the technicality, with two quarters back to back, the GDP decreasing, by the definition, we have it as a recession. And then we had the White House speaker trying to almost redefine what a recession is. It's not really a recession, but so we don't know what's going on there with us. Denial.
You can't redefine stuff, right? So things are happening. So if the definition is already there, I think they are doing that with the inflation. They are doing that with the unemployment. So people have to work right now because they cannot afford even the minimal stuff like how many times we've been talking about this, like people are like elderly, they go back and find part-time jobs. That doesn't mean that they are doing so great, and then that reduces maybe the unemployment. It's because they have to in order to pay their utility fees or medications, they have to. So how many times in the ACO case conferences we talk about patients not being able to afford certain drugs, so then we have our social workers reaching out to them. So this is happening every day, right? So yet still we are actually not seeing a good resolution, and I think like I'm telling you, like, there has to be an age limit for politicians. So because these people are putting this country in trouble. Like I've been here for 23 years, almost 24 maybe, and things are happening in a way that I never seen this before, and now it's affecting everyone. So, and then no one is taking the ownership. But I think it's time to take some ownership with these issues. So now, what happened to Bitcoin?
Yeah, so the cryptocurrency kind of just totally dumped. I think it was around like 19,000 or so.
There's no there. I'm still in. I didn't get out. So it's 22,500 right now.
Okay.
So
better than our 19. But yeah, for those who don't know, it was at one time, I think it was like low 70s, at least upper 60s.
Yeah.
So
we sold like 6,000, right?
No, yeah. So
that was
during right after COVID, I bought not a whole coin, a very small fraction, but it was at the trading rate, it was around like 8,200 or so when I bought like a little fractional share. But it's just kind of interesting to think that you can go from 8,000 for one all the way up to almost 70,000. Now it's back down to 20. So if you're timing these,
are still making money. If they bought it like 4 weeks ago at 19,000,
right? There's these small swing trades that you can. There's opportunity, but overall, though, the cryptocurrency. I know another big one was Ethereum that was down. It was at like 4,000. Now it's down to 1,900. So
next week we have a guest speaker, I believe, right, on the clinical side.
Yes.
From Brandywine Podiatry. Is that next week or the following?
I believe it might be the following.
So
what is today? 5th.
You may be right. So that's
Dr.
Sarah from Brandywine Podiatry. So let me just double check that. So she was. I thought she was actually next week, but all right. So she is.
I believe it's next week, yeah, 12th.
On the 12th, yeah.
Yes.
Dr. Linda Civarelli from Brandywine Podiatry is going to be with us, and we're going to have some other updates. Now, I thought Senator Carlo was coming.
No, we had reached back out, and we did not end up getting any confirmation back from her, which another interesting thing, with what we're talking about, what's in the news and what's not. We know that Senator Calgay works closely with various bills, and one of her main topics is abortion rights. Mm-hmm. And with that was in the news recently, and then all of a sudden there was like a 2-week where everyone was up in arms about it, posts all day on their Instagrams and Facebook. All of a sudden everyone's back to their summer vacation, and there's just no talk about it. But no, we were trying to get Senator Calgay back on, but we did not end up getting a confirmation.
Okay, so I'm still watching on that. All right, well, so that's all we have for today. So we are going to have our Bariatric Friday with Dr. Erkan in 15 minutes. So hopefully we'll see you guys there. Otherwise, until we see you again, stay safe and